There's no evidence that I know of that Wi-Fi has adverse health effects, apart from maybe encouraging a sedentary lifestyle in front of a computer. What were you trying to say? What is your position today on that?
Maybe you didn't see the study that was just released, put out by the National Institutes of Health, actually. So radical an organization of that, just made known the results of their most detailed and accurate and scientifically rigorous study that raises questions. And throughout Europe, you may know, several countries, many countries, and including the European Regulatory Agency, have seen fit to protect vulnerable people from that sort of radiation. I am not saying that the science is done on this, rather that the science has just begun. I personally support a precautionary principle. Having studied at great detail, and I would recommend to you the book that I wrote on this with Physicians for Social Responsibility called In Harm's Way, Toxic Threats to Child Development, which was published in the early 2000s with Physicians for Social Responsibility. We actually reviewed the history of regulation, and in fact, unfortunately, our regulatory system catches up after the fact. Lead is the classic example. You know, why do we have the disasters now in Flint, Michigan, and other places around the world? Because we have lead everywhere, because the public was a guinea pig for lead. It took decades after it was well understood that high-dose lead exposure was devastating. We did not have regulations in place to limit the dispersal of lead throughout our environment and our consumer products, paint in our homes, in our gasoline. We didn't regulate lead until about a century after it was known that lead was a great hazard. Had we had a more precautionary approach that would protect people rather than profits of the industry, we would be a much healthier place today.